Hi, everyone. My name is Stephanie Mitchell, and I'm a psychotherapist in private practice in Australia, on the East Coast, up near Brisbane, in a place called the Sunshine Coast, which is a really beautiful part of Australia. I work in a sort of my private practice is focused on working with people who have a lot of different types of distress that sometimes end up with psychiatric diagnoses. And today I want to talk a little bit about working with clients who have experiences of voices or visions or what we call non-ordinary states or non-ordinary experiences, things that often end up diagnosed as schizophrenia, either short-term psychosis like first episode or second episode, brief psychosis, things that end up called even OCD is kind of on that same level of dissociation as psychosis. And then further down the track, when that kind of becomes chronic, where people end up being diagnosed with schizophrenia, schizoaffective, or bipolar disorders. And I'm going to talk a little bit about what parts are involved, what makes systems use those kinds of ways of communicating and understanding and filtering the world in order to protect themselves. Okay, so I think there are different ways that different people's parts learn in different kinds of family systems, the ways that we all learn to survive. Okay. And so some of us have really strongly manager-led systems, and some of us have really firefighter-led systems, and some of us have, needed to really heavily dissociate, and other systems, needed to maybe respond in different ways. And so psychosis is one form of a response, in my opinion. So essentially what I want to say is it's a fear state. It's a polarization between many parts who are attempting to get something that will help them feel safe. And there's often parts who want something to be known and some parts who want something not to be known. And in an attempt for that to sort of find safety to come out, it ends up being filtered through an attempt of one part to have something known gets filtered through a bunch of parts who don't want it to be known. And so then the system copes in different ways around how do you communicate something in a way that keeps me safe, but also communicates it. And so I'll give you an example. One of my clients has parts who used to use physical hallucinations. She would feel things in her body, and it felt like spirits were attacking her, or sort of some sort of like persecutory sort of non-ordinary, not human, but outside of our realm was coming to persecute her. I've had other clients who believed they were the devil. I've had other clients who believe they had demons. So kind of various levels of this sense of being persecuted. And when I finally build enough trust with the client that we start to understand and ask the parts why they do that, they always have a really good reason. Okay, why are you giving this voice? Why do you give these physical sensations, really is what it is. And sometimes initially all they're saying is like, you don't know how long I've tried to scare you for. I've been trying to scare you for a really long time. And so we're getting little bits of information about the role, and we haven't heard yet why it's necessary, other than it is, okay? And when we finally start to hear more, there'll be things like, I had to scare you to keep you away from danger. And then there's long lists of what this danger is, okay, including danger at knowing how bad I am, okay, that if I don't keep you away from something, I will find out I'm bad, and you're bad. Like, this is the system saying to each other internally, we're bad. And so the parts start to do that. And the same with mania. Mania can be used as a way to take a person away from ever feeling the pain that's inside, for instance. That's usually the thing that I hear from manic parts is like, this is a very clever way when I start to go into shame, when I start to flail into some of my old places of wounding so I'm triggered basically, I can run to that mania place. It has a lot of disinhibition in it. The parts who disinhibit are kind of don't care about the collateral damage because they're just so trying to get away from something that's enormous. Their fear is it's so enormous inside. We kind of need an enormous action to counteract it. And different different people have different ways that their parts do this, okay? I've had clients whose systems that because they give them auditory hallucinations, and these are voices that are actually outside of themselves. Okay, there's voices that are inside, and then there are voices that are outside. And I don't know if you know or not, but when parts can control the body and the sensations and different parts of the brain and responses and things like that. So there is actually MRI studies have shown that the auditory pathways in the brain that would normally light up when you hear a sound light up when a person hears an auditory voice. So our parts can actually influence that. Okay. And so if someone's hearing an auditory voice, initially I might just spend some time finding, why does the voice say that to you? How is it trying to help you or not help you? Like, is it okay? Is it even safe in the first instance to ask the voice? Is there other parts who are afraid? So the voices might be representing someone who's outside of the person, who's a scary person, in order to either shut down the client to not do too much, again, safety, or to tell them they're bad because, again, there's some reason they need to keep knowing that they're bad. It might be telling them something else. It might be a really positive voice that's kind of like Jesus, or someone who tells them that they're a special child of God and they're going to do something special for the world. And they're the savior, they're the new savior to the world. So each of the voices kind of has their own way of communicating something in order to help the client. There's a couple of important things I want to say about voices. One is that a lot of these clients, it was necessary to take what's difficult inside of themselves and make it not them. Okay, so there's a really big separation between what is me and what is not me. Okay, and so what I cannot have inside of me, both negative and positive, must be put outside of myself and disowned as not me. And so for some clients, it's only the negative, and some clients, it's only the positive, and sometimes it's both. Okay. And there's some sense of this thing comes from outside of me. Okay. And what I would say is that for a really long time at the beginning of my work with any client who's going through these experiences, I'm not interested in trying to change what they think. I'm not interested in trying to help them see that they're the ones externalizing this, right? That's really, really unhelpful. So this is just information for anyone who's working with clients and they themselves get caught up into confusion. Like, why does the client do that? How come the voices are outside of themselves? Especially when it's perpetrator voices. So if it's like, I hear the voice of my perpetrator and is after me still, then, it can get confusing for therapists and other mental health professionals who are alongside, or even family members, to wonder, why does the voice still follow them from this person? Okay. And so there's some important reason about something that is outside of my control, that I am powerless over, that is not me, but impacts on me. And the reason that that's important to know is that I believe, well, the power threat meaning framework, actually, it's not just me. My point of view is informed by things like the study by Lucy Johnson and her other research participants on which is called the power threat meaning framework. It's a study that was done over several years, looking and asking and looking at different understandings of what we call psychosis and people's experience and what happened inside of them and their experience of what caused it, how did they make sense of it, what was it like, what would help them, what didn't help. This is kind of my understanding of the study. And she said that essentially it comes down to a deep sense of powerlessness, and that's an incredible simplification. And I suggest that you read the study. It's really easy to read. There's the longer version, which is over 400 pages, I think. There's a shorter version, and but the shorter version has a lovely summary, including some great suggestions. Essentially, the person feels in various times in their life a sense of powerlessness, and then that becomes kind of externalized as this thing that they're still feeling powerless about. Okay. So what we're wanting to do when we first start is offer a space for the client to feel they have some agency, even if it's only in a small moment. Okay. So, when a person first comes in to see me, the only thing I might be doing is just being curious about their experience. Tell me more, help me understand. When did the voices start? When did you start getting these sensations of the spirits coming to you? What do the voices tell you? Were they ever positive? So sometimes it's quite common for voice hearers to have had voices from quite young, but it was positive. They used to teach me skateboard tricks, or the angels came to me at night when I was asleep, or the demons. I've been having nightmares since I was a kid that, like monsters were after me. So there's kind of like, there's the now and the here, which is to do with what is happening around the fear and the voices and the sensations and the beliefs and the sense of people out to get me. And then there was like earlier places that were showing distress, but were not maybe as triggered into this malevolent, frightening place. And so that's just important, okay? Because as you start to get curious and help the person track and unpack, and you're not going to do it in a linear way. It's going to be many, many sessions where you're just asking some questions and you're going back and forth. And your job as the person who's alongside is to just track that over the longitudinal journey of your work together. And the safety making that happens with the client when you are curious and then pull away from being curious is really important. So there's some sense of, I'm here with you, you're telling me about your voices, I'm wanting to understand more. What is it like for you to have them? Is it easy? Was it ever easy? Is it hard? Do they ever stop? So a lot of times people say like the voices are never quiet. The voices, I have no control over them. And to begin to start to ask some questions about like, okay, what about when you sleep? Do they come in your sleep? Yes, they do. Okay. What about like when you're chewing gum, like, is it any time? Sometimes they'll initially say no, and then when you go and sort of spend more time over many, many weeks, they start to notice, you know what? The one time they're not around is when I'm brushing my teeth. Great. Okay. The voices go away when you're brushing your teeth. Interesting. And then I'm working with a client at the moment who his voice is just nonstop. He said, I can't sleep. I'm exhausted all the time. And I said to him, sometimes it helps to just say to the voices, I need a break. I will speak to you 15 minutes in the morning and 15 minutes in the evening, but you cannot talk to me all day. And for that client, that worked. Now, I was quite willing for it not to work. I was quite willing for it to turn out like I wasn't going to be hung up. I wasn't going to feel like I didn't do it right or he didn't do it right if that didn't work. But for his system, it did. Now, we were quite a few sessions in before the voices started to be constant. At least in this most recent round, he'd had other episodes. And we'd already built quite a lot of relationship between himself and the voices, okay? And the voices, none of his parts or voices really trust him that much, but they have had a little bit of a taste of both me and him offering some sense of like, anything you do is okay, we're okay with it, okay? And I want to be in relationship with you in a way that feels safe. And so when he set these boundaries, it worked. I think if I had just gone in on week one and set boundaries with his parts, they might not have been that interested. Okay. So I'm only saying that because no technique is going to work. It's about relationship inside and outside and in between the client and I and in between their parts and themselves. So I'm just going to take a pause. So if we think about the fact that a person has come from experiences of some form of powerlessness, okay, it can be being bullied, it can be a parent who was really overstretched and so they felt misunderstood as a child. It doesn't have to be abuse. It doesn't even have to be like neglect or trauma, but there's usually like cascading experiences of powerlessness or power over that they experienced. Okay. There's also some pretty good evidence that it's a family communication pattern. And in my opinion, that's why it runs in families. It's not hereditary. There's no schizophrenia gene that they have been looking for, even though they have been looking for 50 years. There's some good research on some meta studies that ran twice, looking at, so there was like older meta studies and then a meta-analysis and then newer meta-analysis that looked at some of the earlier brain scans that were done, kind of saying, oh, this is proving schizophrenia. And then they looked at brains who had trauma and they're like, oh, same, similar things going on here. So it really debunked that idea that, you could kind of gauge it. Also, those studies did not factor in brains that have been on medication. There's not really a group of people who have not had long-term medication if they've had diagnosis of schizophrenia, that they can say, here's a brain with quote unquote schizophrenia after 25 years of schizophrenia, and here's a brain, and this brain has never had drugs, and here's a brain with 25 years of schizophrenia, what we call schizophrenia, and have had drugs. And so they were doing a lot of like, oh, look, schizophrenia causes brain shrinkage. Well, no, medication causes brain shrinkage actually. And until we can have, a control group, we won't know. But what we do also know is that some of the effects of shrinkage in certain areas or activation in other areas is really common for people with trauma too, okay? And a little word on trauma. Trauma is any experience that is beyond my ability to manage and cope with it at the time that it happens. Okay. So as I said, that might be a sense of, I'm the seventh child in a really big family, and what happened when my mother was pregnant with me, or straight after I was born, or any number of other things meant that things around me were not helpful, and there was some form of like my attachment needs not being met, and then a cascade of other things going on where maybe I ended up feeling like I didn't matter in the family, where I felt really, maybe I got bullied by an older sibling or other such things. And this sense of powerlessness, right, compounded. And then maybe I go off to school and there's a little more bullying. And so now that's like compounded more. And then I get to university and all the wheels fall off and I end up with this thing called schizophrenia. So if we understand that there's kind of like an overarching experience of powerlessness without any blame to anyone, and then there's familial patterns, and the familial patterns that are important to recognize are the communication patterns around a client's parents or family who they have their own level of wounding in such a way that there's a need for the client to respond, but then when the response comes, it's shamed or criticized or twisted or something happens. And then there's a secondary response of the client, and then the secondary response is also like somehow something happens in that moment where they can't really escape. So they can't fight, they can't flee, they can't fawn even, because no matter where they go, there's some kind of intrusion. I'll give you an example. I had a client recently who said to me, with my mom in the current situation, when something happens between the two of us, it's like her energy intrudes on me. And I went, oh yeah, that's exactly what I hear from all of my clients. There is energy from my caregiver that intrudes on me. And I was trying to say, do you know how that happens? Can you feel and understand? And as we unpacked it, many, many sessions, by the way, this is about 3 years in, and I heard someone recently say, the work doesn't have to take this long. No, it doesn't. I have a client who's had, I don't know, 4 months of sessions with me, and her system has gone so quickly, but other systems take time, okay? So all of that is just to say that wherever your clients are is okay, and this client is 3 years in, okay? And what he was telling me is about this energy from his mum that kind of comes over him. And over the sessions, what I've started to realize is mum has some attachment wounding herself that's very anxious about uh, not being connected. And so what happens is the child does something, mum gets dysregulated, the child tries to respond, and the mum gets more dysregulated. So the child withdraws, and then mum can't cope with the withdrawal. So she kind of comes over to sort of be a bit like, help me. And then the child's lost because it's like, hang on a second, I tried two different things and they were both criticized and wrong, and you told me off and you did the thing. And now you're kind of coming over in this like, I'm supposed to take care of you, but it'll be wrong. And so what this person said is, I can't kind of get her out of me in that moment. And so I just thought it was a beautiful explanation for this person's experience of some kind of intrapsychic intrusion, okay? Which when you think about, the CIA coming after me or aliens or entities, it's a metaphor, in my opinion, as an externalized explanation for something that has been in a relational space that has not been able to be spoken for. The other thing that it is, which is really important, is it's something that the client can't know. So a lot of people come and they can't know something about themselves or the other person. So I've had clients who come, and what they must not know is that they're angry at their parent. And then that often works out in other relationships. I cannot be angry at my intimate partner. And then the moment of psychosis will come when something ruptures in the relationship. Something happens. So, someone will, feel like strangling their partner, for instance. And it's like, whoa, hang on a second. Because of course I can't even know I'm angry, let alone violent. And so there becomes this kind of like build up, and then there's like some kind of response inside from the I cannot know to I know, and now I'm the worst. Sometimes that's brought on by drug taking. And for me, the drugs don't cause psychosis. The essentially what all psychedelics do is that they relax managers, to be honest. And they call it, psychedelics are non-specific amplifiers. Okay. So whatever was already in there gets louder. And if you're suppressing a whole heap of anger or suppressing a whole heap of frustration or feelings about someone, or knowing you're bad, or knowing that you're really good, you're not allowed to know you're good, okay, then that's going to come out. And then what happens is the person comes to the hospital after they've taken psychedelics, they're having a psychotic drug-induced psychosis, and that's what it's deemed to be, when really what is happening is that the thing that was suppressed is starting to come out because the manager's kind of offline for a little while. And that experience is very terrifying because the managers have spent all their life trying to keep this stuff under wraps. So if we can begin to understand what happened, okay, so one of my clients, during some taking of some drugs, did some things that he regretted later, made him feel like he was a bad person, an evil person. And really, when we unpacked it, he was very angry at his girlfriend and couldn't know it. And then he took the drugs, and then he got really angry, and he didn't do anything violent or anything. He just said things that were unkind, and there was some other kind of relational ruptures that he felt made him an evil person. Sometimes there'll be sexual things like cheating, or maybe believing you're a homosexual, or some people believe they're pedophiles in those moments. Like those ways that something comes up that you start to believe about yourself as metaphor. That becomes available because of what is suppressed. Okay. And um, and so it's becoming curious. So one of my clients who had left his girlfriend, he had been wanting to leave, and then his psychosis basically helped him do that. But of course, he kind of hated himself for it. There was a lot of, I'm a bad person and she's a lovely person, and no ability to allow himself to be angry. That took quite a long time for the not knowing, the not me, to be able to come out. I am angry and I did want to leave. And the only way to do it was in this angry way that I regret doing because I hurt her feelings. Some people, yeah, the way they leave, they regret, and then that kind of proves their badness. Um, Yeah, let me just take another pause. Some people have a spiritual experience, and so there's so many reasons for that. One of the reasons is that, people just have a spiritual emergency. They have something emerges and they really do literally go into another realm and kind of have an experience of God, have an experience of something very divine. They have a sense of being connected to everything. And for me, as soon as we as therapists or mental health professionals start to say that isn't true, we're gonna put a wedge between us and them. There's no we lower the chance of them getting better. Okay. For me, it has been my experience that is true for people. And it's weird what happens. People seem to know things, people have experiences. My own experiences of things that are outside of my understanding have usually I haven't had experiences what gets called psychosis, but I have had experiences of in meditation, and with my parts and through my own healing, being in touch with the big everything, right? And so I trust people's experience of they are in connection with something, and I want to stay open and curious to that. And anyone who's having the experience of what gets called a spiritual emergence, as a practitioner, I would suggest you learn a bit about what spiritual emergence is, understand what the people in the spiritual emergence networks actually are doing to help people navigate through that. My personal way of helping someone navigate through that is to build a sense of relational safety that's open to their experiences. Like, I'm curious, tell me more. I'm not really doing anything different from someone who's telling me about, like, I'm a bad person, and Jesus is talking to me, or aliens are speaking to me, or my best friend is, like Tom Hanks or something, right? A movie star, than I am with someone who's telling me about their spiritual emergent experience. I'm just going to believe everyone and be open and curious to it, because that's how healing happens. And whatever that looks like, and how people heal is really up to them. So to come back to IFS, what I'm doing as an IFS practitioner, I have a grounded sense of self. Like, if I'm not afraid of a person's experience and I'm in a lot of courage and clarity, I don't have to agree with the person's reality in order to be alongside their experience and their perceptions. And there's a thing in the hearing voices community where I initially was trained to kind of say, well, I don't hear the voice, but I believe you do. I just never even have to say that, to be honest. It's like, I don't know, it just seems like such a strange thing to say to someone. Um, the way that I'm holding the client is totally different. I'm so uninterested in what's real and what's not from the perspective of them having to prove anything to me. And because they're not trying to prove anything to me, and they're not feeling me think that what they're telling me isn't true, they don't have to ask me, do you believe in the voices? Do you think? So, yeah, it's just not been something that I used to when I was in different places with the way that I worked with clients in the early days of hearing voices work. I used to try all kinds of different things, and I think clients felt me. They felt me not really believing them. So they would say, do you hear the voices? Do you believe I hear voices? Do you think the voices are real? Do you think that, and so yeah, I don't really get that happening anymore because my sense of I'm here for you in a way that's interested in you doesn't make them feel like they have to check with me in that, like, am I crazy or is it like, yeah, anyway, it's just not a thing. I can't really explain to you why. But I'm saying that's kind of over there, and what I'm offering is I'm just here with you, right? I often say, help me understand. I don't understand everything you're telling me, but it's so important to me. I want to understand. And for us as practitioners, I want to tell a little story. I have a friend who's a psychiatrist, and he once said that one of his clients starts to talk in a way that he doesn't understand, he dissociates and he starts to get anxious. He dissociates, so he feels himself kind of like not really paying attention, feeling a bit anxious, and wanting to convince the client. And I was like, wow, when you can have that level of mindfulness, you have a much better chance of staying with your client. So part of the work as a practitioner, as an IFS person, is for me to notice my parts and unblend. Okay. So if I find myself kind of going like I'm lost, I'm a bit confused, then first of all, I want to check, have I got some part of me who's trying to do something? Like, is there a part of me that's kind of thinking it's up to me to make sense of this? Because if I do, I want to ask that part to step back. Okay. And I want to come back to seeing if I can reflect. My biggest tool is reflecting what the person says. And if they tell me and I reflect and it's too much, just move away. Because again, there's one part who's saying something that wants to be known, and another part's afraid to have it be known. And so if I was to say, wow, I'm getting that, and they go, no, that's not what I said, or the aliens are in this computer mouse, then I know in that moment, even though this one told me and all I did was reflect, it's too soon for everyone else in the system to know that. And so for me, the curiosity is kind of like a open, spacious, I'm following you around. I'm just really, whatever's important to you is what's important here in this space. Not 20 questions. Here's my list. Here's Stephanie's list, and we're going to tick it off. Yeah, so everything about psychosis, in my opinion, is a fear state. And what I would say about the fear state is if I can stay unblended from fear and be curious, the person's nervous system feels me in that co-regulation, right? I'm in dorsal vagal and they can join me there. And psychosis is like transient, right? Ronald Lang used to talk about the fact that he didn't see a lot of psychosis in his room, even though all of his clients were supposedly psychotic, because of course he created enough safety. They didn't need that to kind of be the shield between the client and the therapist. Um, so if we think about it as a part is trying to do something in order to keep safe, because relationships have been kind of annihilating, they'll talk about their experiences in those terms, like they're basically afraid of annihilation. They're having what a lot of people feel they're having an existential crisis. They're trying to, one of my clients at the moment says, when I was having all those experiences, I was really just trying to understand myself and the nature of the world. Well, yeah. if you're a kid who's not allowed to know what you're not allowed to know about yourself or anyone else, and you're not allowed to know your feelings, you're not allowed to understand your parents, and all of this has to be shut down for safety. And then on top of that, no matter what you do, there's kind of a person who has their attachment needs that are kind of intruding on you so that, it does feel like something's coming into you, which is what I hear from clients. Not the parents mean to, not that they, that I get it. You've got attachment wounding as a parent. I have attachment wounding. Then of course the client is kind of going to need some sense of, can I tell you something, Stephanie? And then can you let me pull away? Because that's something I haven't been able to have before. So for me, this moving away, moving toward is the relational safety making with parts. And then over a period of time, I'm asking some questions like, I'm listening for themes, okay? And the themes are, powerlessness, good and evil, sexuality, religion, God and the devil, these kinds of things, but also themes from childhood. So a story I use a lot because it's easy to understand is a client of mine who was telling me how, this force from another dimension had influence over him in the present. And as I was asking him more about that, he said, I just feel like I can't win because this other force, like I'm doing my best, I'm trying to be so good, and this other force comes in. And I just went, I want to pause a second. Can you, as a listener, hear the core wounding message in what he just said to me? What he said was, I can't do anything right. That for me is an early attachment wound from somewhere, parent, school, I'm not sure. And so what I said to him initially was, wow, oh my God, you can't get anything right. Wow, that sounds so tough. Now, he thinks, and I am as well, he thinks I'm talking about this other dimension where the beings in the other dimension influence him. And I am, because that's what he's talking about. But now I invite him to think about a bigger picture. And I said to him, how long have you felt like that for? And he said, oh, since I was a small child. Okay. Now he's giving some biographical information about exiles and the wounding that happened to him. We don't know the content yet. Okay. We're only getting this little bit. And I'm going to eventually, over the period of our relationship, begin to help him to see whether he can link that to these beings in another dimension. But I said to him, wow, okay, so ever since you were small, and then I had the extra question, what made you feel like you couldn't do anything right? And he said, oh yeah, my mum. And then when I reflected back, wow, from you, when you were very small, you had a mum who something happened where you felt like you couldn't quite get anything right. And he's like, oh no, my mum, it's very important. My mum, I love my mum, and I would never want to say anything bad about the person who gave birth to me. And then very long explanation to take us away from something. And no more going near that. I can't remember. He changed the subject, and then he probably did look what we call psychotic. Initially that was kind of like talking about, like my mum and how good she is, but then there were some other words in there that were kind of jumbled. And but it was just, for me, it's a way of the client sort of going, wow, something felt really a little too scary to talk about right now. And so can we just stop for a minute? And so we just let it go. And then later in the session, a part will tell me again something important. And I'll be able to go like, oh, that's so interesting. You just said this. And then there might be a little bit, or there might be a running away. Sometimes the really important thing also with someone who's having any experience of voices, visions, fear of things in kind of like real life or outside of real life coming after them, what is important is this sense of that I'm just interested in them as a human being as well. If we focus too much on just endless amounts of therapy kind of work, the self of the person gets lost. And one of the most important corrective experiences for someone who has these things we call psychosis, these experiences we call psychosis or mania or anything like that, is that they haven't had enough sense of their own personhood being good, welcome, interesting, acknowledged. For them, their sense of that hasn't been adequate. And I had someone once kind of say, well, this person, their parents are great and they had no trauma and blah, blah. I said, well, however you want to phrase it, frame it or phrase it. Maybe the parents were fantastic, but for this sensitive child, it still was not enough, okay? That's the important thing. If you want this person to, we're hoping to help them feel less afraid, okay? And if we're going to do that, we have to accept their reality. And their reality, once you actually get past the metaphoric language, is I didn't have someone who delighted in me enough, was safe enough, who felt that I had some agency in this relationship where I didn't have just complete power over me more often than was safe for me. Okay. So I'm just really inviting you, if it's a stumbling block because you are a parent or you're someone who works with a lot of people and you're like, they don't have big T trauma, I'm inviting you to know this is the client's experience. Okay. And they're not going to call it big T trauma probably either, because that's the nature of the problem. Okay. Um, People with diagnosis of borderline or those kinds of other pejorative terms for dissociative and early attachment wounding, that stuff is like they often can easily, dissociative identity disorder, they can often easily put together what happened to me and what I'm currently experiencing. Over here with the psychosis, it's really important that they don't kind of know. All right. So if we know that, okay, they have had some kind of experience, whatever it is, where they didn't get enough of delight, interest, acknowledgement. You're a great human being. We want to do that. We're going to have a corrective experience in the relationship. Tell me all about your skateboarding. Tell me about your tattoos. I had one client who was really interested in hydroponics. We spent so much time talking about hydroponics and just my delight in him as a human being. And in between that, of course, there are therapeutic moments. And I think that that's probably, in regular talk therapy, that's something we do more of. And in IFS, we don't do a lot of that. And so my invitation for you is to let the client lead you where they want. And sometimes that means there's a breather session in between what can feel really, one of my clients said, gosh, this therapy stuff with you is so confronting, Stephanie. I'm like, how? Because, I feel like I'm pretty gentle on him and I don't drag him to things that are difficult. But even the gentle work we do is so confronting, which is really, that's the nature of the experience of what I cannot know. Even a little bit of knowing is too much, okay? And so if I think about that, then sometimes we might have done a really big piece of work where there's like, oh, I'm seeing something huge. And then the next week, we're just going to talk about hydroponics and the latest, program that this person's coded on their computer or whatever. And then, whatever other interest, the latest book that they're reading or whatever. So I think for me, once you have that stuff down pat, understanding it's protectors who do their work to have the person believe and fragment into me and not me. The voices are or the tactile hallucinations are just messages about something that can't be known, and we're slowly building connection around what can be known and what needs to not be known and allowing the toing and froing. If that's all you do for a really long period of time, the person will come to a point where they want to work with their exiles. It takes a while. So and it depends whether they came to you for IFS. If they found out about IFS and they came to you for IFS, they're going to get there quicker. So for me, I have one particular client who has come to me, and this person wanted to do IFS from the beginning. There's no way we would do an IFS. This person was nowhere near ready. Couldn't even identify the early trauma. Could only talk about the trauma that happened when they were hospitalized on multiple occasions in the psychiatric ward. And a lot of what they were talking about is like, help me, help me, help me, was with the spiritual interference they were having. So for me, helping that person begin to put together the narrative between the now and the back then has been really significant. But they also wanted IFS. So I was saying to them, if you want IFS, this is where we're headed. I get it's scary, but like it's also part of what we're going to do. And that person has gotten there a lot quicker. We've probably been, I don't know, twice weekly for 6 months. And we get moments of exile work, and then it never gets anywhere. You can't do an unburdening usually. Well, my clients so far have not been able to do that in the first while. I don't know how long until they're ready. We get a portion of an unburdening, and then they're protectors. And so what I want to say to you is like, just let it be. Let it be that was as much as we got. And now we're here again with the invitation of going back there if they ever want to. There is one thing I'll say that I don't use a lot of, which is sometimes I've heard practitioners who use a little bit of like helping the person get more and more into self as a way to kind of connect to the big self, especially if they have some sense of spiritual emergence in their unfolding of their experience. I have met people who say that has really helped them, the clients, I mean. It has really helped them to feel safer a lot quicker. My only caveat is as long as it doesn't become another manager bypass that keeps them away from really being able to turn towards what's difficult. And it's not the way I tend to work, but it works for some people. And I've spoken to clients who've having a huge amount of success. And one of these people I spoke to, I met through just some mutual contact. They said to me that sometimes when their voices are saying all the things, instead of what they used to do is argue with their voices, now they just tell their voices they love them. And the voices, that really helps a lot. There's another thing I wanted to say, and that is that I have people who sometimes want to do multiple different modalities, and my way of working is I don't care. I'm like, yeah, go and try it if you want to do that. Akashic records or something is one of the things, some sort of spiritual thing that I don't really understand. Someone else did kind of like some Reiki kind of a practice. And because it's all about empowerment, it's about trusting the client, being able to trust their own knowings and trust their own healing. And like they know how to heal. And as a practitioner, I'm alongside with all the power in this relationship as much as possible. Of course, there's always going to be a power imbalance, but as much as possible, you're the one who has the power here. And I'm going to follow you and your lead. So go and try that. Now, if it doesn't work out, I'm here. I'm here as a backup to help you. So I had one client who did some particular spiritual things that really backfired for her and frightened the bejeebers out of her. And she had a part who kept wanting to go back, even though other parts really protested. And so for me, it's all about dignity of risk. The client gets to choose. I want to give them the dignity to choose whatever they want, as even if it's difficult, including taking drugs or whatever else, okay? Without opinion, without me telling them what they should or should not do. Because if you're supported my big thing is if a client is supported to find their way through something, even if they keep, getting hospitalized again through doing whatever the thing is, or taking drugs and then having a really difficult experience again, or going to, in this case, a spiritual teacher that frightened them. Interesting. The part who really wants you to, and you kind of can see that in other ways other parts don't want to, and you're frightened all the time. And let's find out from the part who does want to, what is it hoping to get? Could we offer it something here? Would there be something here that would work with you and I together for this one? One of the things that we can do is offer a safe place sometimes. That works for a lot of clients and not some. One of my clients had been offered a lot of safe place by another therapist, and it became a really scary experience. So for her, she's like, no safe places, it's too scary. But other clients, it's kind of like, wow, what if these ones who want to go off to that spiritual teacher, but it frightens them, instead, we gave them a safe place that they could be with. Or one of my clients had a rope. So it was like, this part doesn't want to be around because it doesn't like what these other ones, all the voices are saying, but it's afraid to leave. And so I'm just scared all the time because it's close. And so in the end, we had this situation where we said that one can have a nice long rope, a thick rope, like a tight rope. So like a tug of war rope, nice big fat, like a ship would have almost. And it can be a long way away, but still connected and safe. And that made a huge amount of difference inside of the system. So, if we think about that as in terms of like self-energy, what I'm thinking about is my creativity, the client's creativity, self-energy, my curiosity, my clarity, my presence, my courage, like I'm not afraid. Which brings me to, I want to just briefly talk about, sometimes clients have sexual feelings for us, or even negative, like my parts are so mad at you, they want to hurt you or kill you or whatever. And just for us to remember, it's only a part attempting to communicate something through metaphor. And if I am not ever allowed to be angry and there's suppression, then the one who bursts through to say the thing sometimes is extreme, like a small child is. So small children say, I hate you, mummy, I wish you were dead, or something. And none of us get scared about that. So I would invite you to know when a part or a voice says, I want to blow something up or whatever, okay? I'm always curious to first of all, yes, okay, this one is letting me know something so important. It wants to blow up the whole world. Can we just find out what just happened there? Something I did felt really bad, or something that person did felt bad. Can you tell me more? If it's appropriate, I'll just offer an apology. I'll slow down, I'll pull back. There's some way that I want you to invite you to be in the moment in a way that's not afraid, but is responsive. I can't give you the answer from a video here, but you will feel the answer. One of the things that can help is to, once you've reflected, so don't do this straight away, okay? You're going to reflect back, you're going to stay with, you're going to be curious, you're going to find out more. Honestly, also check if it makes sense to you. Like my client who said to me he wanted to have sex with me, I said, wow, yeah, great. I'm so glad this part's telling me. I wonder what it would mean for you if you could have sex with me. And he's like, well, it would mean, you know so much of this terrible things about me. If you had sex, it would mean I'm valuable and desirable. And I was like, yes, of course, that's what this part thinks. That this place in you that feels completely undesirable and not good that would be somehow redeemed. That makes sense that parts would want that, of course. Now, of course, I know that's not going to work, right? That would feel, there would be so many layers of how much that wouldn't work if we went ahead and did that, right? You would know that. It's not only my professional boundaries, it's also that the client would still have the wounding, right? So for me, it's like, yes, that's true. What your parts believe makes sense, right? It's makes sense to me that they believe that's true, is that's what I meant to say then, right? And that's okay that they think that. And I kind of have some bad news for them, which is that I don't think it would work like that. I don't think that even if we did have sex together, that your parts would really get that sense of worthlessness resolved in them. I think that it's more of an inside job, which I'm going to help you with in a different way. So for me, if I wasn't curious, if I was frightened of it, if I was not in my own self energy, okay, then that could have gone really badly, okay, for the client, not for me. For the client, I'm the one with all the power in the relationship. So for you, I suppose what I'm saying is stay curious and open. And I'm just going to pause another second because I had a point. Oh, after all of that, so whether they've told you they want to blow up the world or have sex with you or, you know, they hate you and all these kinds of things, and you've given empathy to that part, then it can be helpful to ask, how is it for you? So if my client's name is Peter, how is it for you, Peter, that these parts feel this way? I've never had a client say to me, it's great. They normally feel, I'm so embarrassed. I can't believe my parts said that. Or I don't want that. I don't want to harm you. I don't want to, like blow up the world. Or, there's ways we can kind of check, because it's only a part, it's one part. And that's why IFS is so great, right? We know a part speaks at various times. I blend and it feels like all of the person, and then we offer empathy, and then there's unblending, and now we have a little more clarity, which is a quality of self, and we ask the client, what about you? Okay. And of course, in IFS, we have all these extra layers of lovely language around, like, does it make sense to you that this part feels this way, given how upset it is? You may or may not be able to do that with the person. You may be able to just say, how is it for you? Okay, because they're not fully aware of their self energy. They bounce between me is the part who wants to hurt you, and me is the part who's embarrassed, and me is the part who doesn't want to do that or loves you or whatever that is. And so we just allow that to be, right? It's implicit direct access. So I hope that helps to understand sort of the IFS kind of overview of why parts do what they do, the etiology, as well as the kind of process of therapy, the arc of safety making through to eventually working with exiles, and your grounded presence. Okay.